series of press briefings that we have been organizing from the Africa Centers for Disease and Control and Prevention since the beginning of this COVID-19 pandemic. Just for your information, we will be having updates from the director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong. And after that, you will have the opportunity to ask your questions and he will be responding to them. Now, if you have a question, we have different options that you can use to send us your question. One is that you can type in your question in the Q&A box that beneath your computer. Please put your questions, type your questions in the Q&A box, not in the chat box, so we can easily see them. Secondly, you can send your questions to the Africa CDC Media WhatsApp group, and then we pick it up from there. Thirdly, you can raise your hand and we'll allow you to speak to us and ask your questions directly. Lastly, you can send your question also to the WhatsApp number +251 945 502 310. I repeat, +251 945 502 310. Also, I would like to inform you that we have interpretation services in English, French, and Portuguese. So if you look at the bottom of your Zoom window, you will see an interpretation button. Just click on the interpretation button. If you prefer to listen in French, you click French. And if you prefer to listen in Portuguese, you click the Portuguese button. And then we go on like that. So without wasting time, I would like to hand over to the Director of Africa CDC, Dr. John Nkengasong, for the update for this week. Thank you.
Thank you, James, and greetings, colleagues from Addis Ababa, the headquarters of the Africa Centers for Disease Control and Prevention. Let me just start today by truly acknowledging the strong partnerships and support that Africa CDC continues to receive from multiple partners, donors, and collaborators. I think there are so many to list. It is thanks to this very gracious collaboration and partnerships that Africa CDC has been able to respond and support the continent across multiple areas, including funding, supplies, and distribution and technical assistance. I also then like to truly recognize the healthcare workers that have been at the front line of all of this, the battle for the last 11 months. I have been going through the continent and going to sites and see how frontline workers are battling this pandemic, from laboratory to technicians to lab experts and medical doctors. As you all know, I was in DRC last week and had the opportunity to visit firsthand and see how these frontline health workers are fighting and answering. And of course, lastly, the media, the journalists that we gathered on this platform every Thursday to discuss the pertinent issues. And your continuous collaboration, partnership, and cooperation will be critical in determining the manner in which we fight the second part of this pandemic, which is going to be characterized by the need to have effective biomedical interventions. As always, I'll do three things. One, I will first start with the epidemiological update of the COVID-19 situation in the world, but we're more focused on the continent. Then discuss the testing, how the testing is evolving, and just conclude by sharing with you updates on some efforts that we continue to do in partnership with other organizations to support member states as much as possible. So first of all, the epidemiological update. As of 9 a.m. East African time today, over 67 million cases of COVID-19 infections have been recorded across the world, of which 1.5 million deaths have occurred. On the continent of Africa, 2.3 million cases of COVID-19 have been reported across all 55 member states, and that represents 3.4% of total cases reported globally. We continue to see a remarkable level of recovery. About 1.9 million out of the 2.3 million have recovered, representing an 85% total recovery across the continent. In terms of death, 54,000 individuals have unfortunately died from this infection, and it seems like our case fatality rate has stabilized around 2.4%, but this represents 3.5% of total deaths globally. The 5 countries that are accounting for close to 70% of the cases in Africa include South Africa with 36%. In absolute number, it translates to about 820,000 cases. Morocco, 17%, representing about 388,000 cases. Egypt, 120,000 cases, or 5%. Ethiopia, 5%, very similar, and Tunisia, another 5% of total cases. Then, if we look at the trends that occurred last week, from the time we discussed last week to now, what has happened, we have recorded a total of 100,000 new cases since the last time we spoke, and about 2,100 new deaths across the continent. And this represents a 7.8% increase in cases, and a similar increase in about 7% increase in new deaths compared to the previous week. If we now look at the 5 countries that are reporting the highest number of new cases just this past week, they include South Africa with 26,000 new cases, Morocco 25,000 new cases, Tunisia 8,000 new cases, Algeria 6,000 new cases, and Kenya 5,000 new cases. If we now look at the regions, and we look at 4 weeks, so what I just indicated is our trends over the last week. Then if we expand that over the last 4 weeks, and we look at the different regions, and that we call that the epidemiological week of the 9th of November to the 6th of December. We've observed an average increase of 3.5 number of cases increase. And by region, they read as follows: 4% increase in East Africa, 3% increase in North Africa, 19% increase in Southern Africa, 12% increase in West Africa. So over the same period, that is the last 4 epidemiological week, we have noted the following trends in the most populous countries in Africa. 18% increase of new cases in Nigeria, 5% decrease in Ethiopia, so Ethiopia continues to record a decreased number of cases, 19% increase in Egypt, 44% increase in the Democratic Republic of Congo, 27% increase in South Africa, and 5% decrease in Kenya. So that's the trends. And we select these countries just to focus on those countries, the top 5 or 6 countries with the highest number of population. Then if you look at the deaths, and you see what is the trend, I mean, we see overall across the board increase in deaths. 6% average increase in Nigeria, 7% average increase in Ethiopia, 10% average increase in Egypt, about 8% average increase in DRC, 19% average increase in South Africa. So with respect to support to member states, Overall, we've supported the training of 12,700 clinicians to enable them and empower them in the ability to manage COVID cases. And I'll come back to that towards my closing remarks. We've also, in the spirit of focusing on this, the case management, also trained over 31 clinicians in Portuguese-speaking countries. This is just happening this last week. And the approach we are using is what we call the training of trainers, so that they can further cascade the training. And also in Botswana, in Southern Africa, that is Zambia, Zimbabwe, Malawi, Botswana, we've trained over 200 participants, laboratory experts, in the ability to manage and roll out the new antigen testing, which we believe will be fundamental and a game changer in the next fight against COVID-19. So with respect to testing, that is a good segue from that, is that as of today, the continent has conducted 23 million tests, and this represents a 3.1% increase over the last week. And again, the 10 countries that are doing most testing include South Africa, Morocco, Ethiopia, Egypt, Kenya, Nigeria, Uganda, Cameroon, Rwanda, and Ghana. As of today, the Africa CDC has received about 2.9 million antigen tests from different partners and distributed more than 700,000 to various member states. I think we are really on the ramp up in trying to move the antigen testing to the communities as much as possible. With respect to vaccines, we have a meeting, a conference next Monday and Tuesday. That is the 14th and 15th of December, starting at 2 p.m. East African time, where the Africa Centers for Disease Control and Prevention will be partnering with the South African Medical Research Council to really have a focused discussion on how do we develop a framework for fair, equitable, and timely allocation of COVID-19 vaccines. Interested member of the media can register and join through a link that we will be able to provide. And our communication experts who are here will be happy to provide that. In the briefing, there will be a briefing next week, of course, following that meeting. But very importantly, there will be a briefing on the perception survey. Remember, I've been informing the media that we are conducting a multi-country survey on the perception of vaccines across the continent. So the results are in. We would like to discuss it and put it public next week. So we will provide specific information as to when and timing of that next week. And lastly, with respect to other updates, in order to increase the dissemination of information to scientists, researchers, and public health experts, the Africa CDC has established a new information hub on the Global Health Network. The hub is accessible through a link, africacdc.tghn.org. The Global Health Network is a knowledge-sharing hub that facilitates the transfer of knowledge and exchanging methods, processes, and research findings between diseases, regions, and organizations globally. So I think it will provide a very good opportunity, like a one-stop shop for health experts and public health experts across the continent. So I think I'll end it, James, and return the microphone to you.
Thank you very much, Dr. Kingerson, for the briefing and the update that you have just given to us. Now, for those joining us newly, and to repeat the information, we have interpretation in French and Portuguese. So if you prefer to listen in those two languages, click the interpretation button and select the language of your choice. Also, you can send your questions to the WhatsApp number +251 945 502 and 310. And you can type in your questions in the Q&A box so that we can see and then take your questions. If you are raising your hand and we allow you to speak, please start by giving us your name and your media organization, and we'll go ahead to take your question. So I take this first question from Norbert Han from ARD German Television, and he's asking, there is a lot of talk about Western vaccine nationalism that leaves Africa behind. How do you see it? That's the first question. Then secondly, he says, what is currently the bigger problem for Africa? That there are still no quotas for the global distribution of the vaccines, or that the supply chains are not yet in place. So he wants to know whether there is, or the supply chain is having challenges. The second question is related to that, from Nicholas Barrio from the Wall Street Journal, East Africa office. He says, I want to know, with the commencement of mass vaccination in the West, the stand of Africa CDC, are there any logistic steps taken to get the vaccine delivered in Africa? And how much coordination with the companies or countries producing these vaccines? So these two questions are on vaccines.
So thank you, James, and thank you, Anne, and thank you, Nicola. The issue is clear that before now, we have all talked about the need to exercise global solidarity, global cooperation. And the time is now to begin to translate those words into action, because vaccines are out there and the vaccination has actually started. I mean, the UK, we all know, started their vaccination program yesterday. What would be extremely terrible to see, I mean, I'd have to find the right word here, is that the world watches Africa not receiving vaccines and see the global north getting the vaccines. I think that would really create a moral issue. I think that there's no word to describe that. I mean, the real word is we get ourselves into a moral dilemma. Many individual Western countries have bought vaccines in excess of their needs. And whereas in Africa, we are still struggling to work with the COVAX facility, which is truly an expression of global solidarity and cooperation. But the truth is that the continent is not going to get enough vaccines from the COVAX facility, for sure, based on a strategic plan, which we have discussed and explained over and over, that in order to secure the health of our continent, in order to ensure that our economies are back and functioning appropriately, and in order to position Africa to reintegrate into the global economy, which requires movement of people, the vaccines become so central. So we find ourselves at a pivotal moment in the history of our continent, where without access to these vaccines in a timely fashion and equitable manner, we will be, our whole developmental process will be challenged. So, I mean, that is an appeal that the whole discourse around equity, ethics, cooperation, solidarity that has characterized this pandemic and call to action should be implemented now. I think that is one. With respect to the quantities and supply chain, I think clearly that we also find ourselves at a junction where, as a continent, we have never vaccinated so many people at the same time. The vaccines that we used to are vaccines but that is a good starting point. We need to start at that point and say, what else do we need to expand 20% of our people before they And that will depend on the nature of the vaccine. The promising candidates that we have, that is the Pfizer, the Moderna, and the AstraZeneca vaccines, come with their own limitations. The Moderna vaccine and the Pfizer vaccine require stringent storage conditions that are minus 20 and minus 70. That by itself becomes a challenge in the supply chain distribution. But it doesn't stop us from establishing vaccination points in capital cities, okay, and start with that. I think the key thing is that we need to start. I think rather than get ourselves completely grounded with the logistics of the coach at Addis Ababa, can we set up 20 vaccination points and put minor 80-degree deep freezers there and point people in that direction? That would be a start. And that will give us the opportunity to begin the vaccination while waiting for newer version of the vaccines that will probably require that we use less stringent conditions of storage. And I think that's the way we should proceed with these vaccinations to ensure that we do not, as a continent, sit back and watch the world vaccinate and we do not get vaccinated. With respect to the coordination, I think the two questions were related, so I think I've touched on both, but the coordination is the key piece there. And you all know that the president of South Africa
my name is Sophie Mkwena. I'm the foreign editor at the SABC in Johannesburg. I just want to ask the director, Dr. South Africa yesterday made an announcement that we have entered a second wave of infections. Is the CDC aware? Have you been engaging with your South African counterpart, the CDC level, but also department level? And what impact will this have in an attempt traffic to South Africa is quite huge, and people leaving South Africa to other parts of the continent. And also the fact that at the moment, at that time where many people will be leaving South Africa, going back to their respective countries, are you not worried?
I am. I think I'm in regular contacts with the leadership of South Africa. The Minister of Health, Dr. Nkezi, is a wonderful leader, a great public health expert. And we talk all the time, and not just for South Africa, but in his capacity as a minister coordinating on behalf of the African Union, because South Africa is chairing the African Union at this point. So, I mean, what you see in South Africa is a reflection of what I just discussed earlier, which is we've seen a rising trend. I mean, at a much higher level, I mean, if I can just depict the way the pandemic curve has moved, we all recognize that we started off slowly in March, and then it peaked in July, August, and then we're able to rally around massively and bring down the curve, the epidemiological curve, to around 7,000 cases a day in September, October timeline. But as we speak now, we have seen the numbers increase steadily to the point that my speculation is that by January or so, or February, we will be where we were at the peak of this pandemic in July, August. So I think clearly the second wave. Having said that, there are three patterns that we see on the continent. Number one are countries that they continue to see increases. Pattern number two is the category of the South Africa and many other countries in Africa where they peak around June, July, bend the curve nicely, ease the lockdown, and now we are seeing the second wave. And then the third category are those countries that continue to see a decrease, like Ethiopia. We have seen a consistent decrease in Ethiopia over the last couple of weeks. So the key question is, how do we prepare for the second wave? We will prepare for the second wave using the tools that we used in the first wave, but at the same time, hoping that we can get rapid access to vaccines, and so that we can use a combination of public health measures and massive vaccination and timely vaccinations to bring down the curve in the second wave. What we don't know with the second wave is how high will the second wave be. Are we going to peak almost at the same level as we did in the first wave, or are we going to exceed the first wave? We've seen in Europe where the first wave peaked around April with about 37,000 cases per day. And the second wave now is reporting more than close to 200,000 cases a day. So I think it remains an unknown on the continent what the second wave will look like. But clearly, as I said, in phase 2 of the fight, we have to use a combination of public health measures plus biomedical interventions. We also have to recognize that in fighting the second wave, there will be a balancing act between saving lives and saving economies, to the extent that we have to really count on the cooperation of the community, empower the community, and make sure that there's an increased understanding of basic concepts in the community. Why would people wear masks for so long? Why should people social distance? I think that requires a very deliberate focus so that we continue to win the trust of our community for them to do the right thing. It is only through the community engagement and community reinforcement and leadership that we will be able to fight the second wave. And so what is happening in South Africa is not unique in South Africa, is what we are seeing across the continent.
Thank you, Dr. Kingerson.
And I may just add, though, that we also find ourselves at a critical period where we are going through the holiday season, and there will be a mass movement from cities to the remote areas. I think that is also an area that I'm making a strong appeal to the leadership of the continent that we up our public health messaging. The political leadership should really stress that as people end of year holidays, especially to the remote areas, to wear masks consistently, wear masks even in family settings, because you just don't know who is going to be coming and have that infection. We just don't want to come back in January and February with a steep increase in the continent. The death rates are increasing and increasing quickly. So I think that is really a cause for concern, that we need to cooperate again the same manner we did early on in this pandemic.
Thank you very much. There is a question that is related to that. You mentioned something about it from Andrew Meldrum. It's saying, is there a danger that COVID-19 could become endemic in Africa, and how can that be avoided?
That's absolutely a very good question, and that's what we as a continent of 1.2 billion people have been saying, that unless and until we strive to vaccinate at least 60% of our population, will definitely end up having COVID on the continent as an endemic disease again. And Africa has already enough endemic diseases that we don't need COVID to install and become disruptive and continue to challenge our health systems in the manner that other diseases have challenged that clearly. So our continental strategy, which is a champion again by the chairperson of the African Union Commission, just yesterday at a press conference with the UN Secretary General, the chairperson of the African Union Commission, Chairperson Moussa Faki, was very clear that we need to strive to get to 60% of the vaccination of our continent in order to achieve herd immunity. And we have to use the best candidate vaccines to do that. And that's the only way we're going to flush the virus out of the continent. So we really are taking that target seriously and working with several vehicles, financing vehicles, the World Bank, the Afro-Exim Bank, and the COVAX facility to achieve that target. And you heard me said earlier on that the President Ramaphosa, as the chair of the African Union, will be convening a very high-level meeting to continue to advance that course, the need to vaccinate enough people on the continent to eradicate this virus from the continent.
Thank you. Our next question will come from Kolita Wanjohi. She will be speaking to us live. Kolita.
Yes, can you hear me?
Yes, we can hear you.
Okay, Doctor, there's a lot of excitement about vaccine now that the UK has already started vaccinating, and in Africa, we're hearing talks of different countries talking about having direct talks with manufacturers is the Africa CDC aware of any individual talks between individual countries and any manufacturer? Then we've also had reports that China is offering to give some specific countries a vaccine if it comes out. So is this under the Africa CDC, or are you aware of such talk? And maybe finally, is the Africa CDC already having talks with any manufacturer? Is the continent already looking at any specific vaccine manufacturer? Because the issue of when it will get to the continent is now becoming an issue. Thanks.
Absolutely, Coletta. Those are very pertinent questions. I think the first thing is that we as a continent have endorsed a continental strategy for vaccine development and access, which is widely known, and member states are aware of this. It was endorsed at the highest level of the continent. It is up to all member states now to adhere to that so that we have coherence in our approach to vaccines in terms of communication around vaccines, access around vaccines, and distribution of our vaccines. If we go down into this, it will be not productive, and it will backfire. And so our continental strategy call for the whole of Africa approach. That is, we go together as a collective and discuss. An Africa organization, task force, a presidential task force, which I'm a member, Commissioner Mira, Chairperson Mustafa Faki, Strive Masiwa, Donna Kabruka, and others, and with a very aggressive mandate to make sure that we coordinate these efforts, get vaccines for the continent, engage with bilateral as well as multilateral mechanisms to get vaccines for the continent. And we are doing just exactly that. We've met with nearly all vaccine manufacturers and have dialogue with them, and some of them are ongoing, and we'll continue to engage with them and bring the results to you all. I think we really want to make a strong appeal to the continent that going alone will not help the individual cause for the country, but we need to do it collectively. There is really this African saying that if you want to go quickly, you go alone, but if you want to go further, you go together. So I think we are aligned with that philosophy of going further, but going together as a whole of a continent.
Thank you very much. We have two questions that are related to that. One from Elizabeth Merab from the Nation Media Group in Kenya. And she's asking, are there countries that have submitted requests to be considered for procurement and eventually to start vaccination? And then another one from Kana Ara from the Associated Press. She wants to know if there are any individual member countries that already made deals for the COVID-19 vaccines.
Individual countries in Africa that we are aware of, I don't know. It doesn't mean they are not discussing. We have only read in the media that some countries are engaging with individual manufacturers. I think, but at the level of officially engaging with us, we are not aware of that. With respect to individual submissions to the COVAX mechanism, I don't know. I would like to engage with COVAX more in a more structured manner so that when countries go to the COVAX and submit that request, we are aware of that and we can help the countries roll that out because there are so many complex issues that need to be still dealt with, like regulatory issues. Do we use a single and harmonized approach for regulation to put a stamp of approval on those vaccines that will gain access to the continent? We should really remember that we are dealing with a very complex issue here, which is to say if we do not handle the vaccine access and distribution appropriately, vaccines there. So that is why Africa's CDC, the WHO have come before there's coordination and which countries are having the vaccine in a totally transparent manner so that everybody has access to the same information at the same time.
Thank you very much. We go a little bit away from vaccines for now, but we will come back to that. You mentioned that the number of cases in Ethiopia is decreasing. She wants to know if this could be linked to the security situation in some parts of the country.
I think that is a good question that unfortunately, we don't have that analysis yet. And we'll continue to work closely with the government of Ethiopia, specifically the National Public Health Institute, to look at the trends by region to see if that is the case. So in other words, it will need to be that we understand that if most cases were coming from the area that is affected, and then we don't see cases coming from that area, then it might actually account or explain why we are seeing a decrease in the number of cases. But again, I would hesitate to be speculative there and just wait to see the real data.
Thank you. Another question from Elizabeth Merab, and she wants to know what is the soonest that we will see an African country start vaccinating its population?
I think it all depends on the arrangements that with the countries and deals that they made with COVAX. I remember that the COVAX had individual deals with countries, I think. But again, to respond to that at a more higher level, my appeal to COVAX and other bilaterals is that for those countries that have bought like 3 times to 4 to 5 times more than what they need, to really repurpose those and bring those to the COVAX facility or work directly with countries and begin to make them, enable them to start their vaccination program. So I cannot put a timeline as to when the vaccination will start, but again, I'll say this, it will be an extremely unpleasing view to see Africa stall and not be vaccinating and witness the whole world vaccinating. I think that will become a moral issue that we have to be very, very careful with. I think my appeal to those who have acquired more and excess vaccines is that let's sit down around the table, maybe through a UN mechanism or a special session of the UN, and just really have an open, courageous, and open dialogue that will establish trust, that will establish the credibility, and that will speak to all what we have been saying at the beginning of this pandemic, that we need to show global cooperation, global solidarity. The time for that is now. The time to translate those powerful words to action is now.
Thank you. We have 2 questions from Pamela Kumba from Channel Africa. She said, the first one, she says, I've read that Pfizer BioNTech's vaccine and Moderna's vaccine, they use a bit of genetic code to cause an immune response. How safe is this? Does it not alter human cells? Then the second question is, do we know how much protection vaccines might give in terms of stopping people from spreading COVID-19?
So what Pamela is referring to is the so-called messenger RNA. And the messenger RNA is this piece of genetic material that will enable a gene, the genetic material to develop a protein. And it is that protein that the immune system in the body sees. Okay, your white blood cells will see that and develop a reaction that will have memory. Okay, so that if you are subsequently exposed to the virus, they react in a very aggressive manner. So the messenger RNA there by itself is not a virus, it's not infectious. It is there just to coat that protein. What we call it, you call it in lay terms, manufacture the protein. And in biology or immunology, they call it you coat the protein. So I think that the messenger RNA itself is not going to integrate into the cells of the body, and so it has no harm. So remember that studies have been done to ensure safety extensively through phase 1, phase 2, and phase 3. Phase 1 studies are designed to test just a small number of people, just a handful of people to determine if the vaccines are safe. Phase 2 is where you continue along the same line of safety, but you expand the number of people. And phase 3 is where you truly look for efficacy and additional safety data on a large number of people. And if you recall, I think the Moderna vaccine and others, they were using up to 30,000 participants. And in course of that trial, you all observe safety, and none of that has been reported. So I think I want to assure the population that these vaccines are safe. It's not the first time that we're dealing with using vaccines. I think personally, I've actually had about 7 different vaccines growing up, including the polio, the yellow fever, and all kinds of vaccines. I think that vaccines are the most potent weapon that we have in public health in the history of infectious diseases. In terms of protection, what we know is that these vaccines protect. We don't know how long they will protect. In other words, are the vaccines going to be like the common cold vaccines, which we tend to get them on yearly basis? And that is informed by the genetic changes that occurred in the common cold viruses. So there will be need to continue to study these vaccines in what we call the phase 4 trials. That is, people that are vaccinated, for how long would their immune system continue to be alert and to fight subsequent infections. So based on that, it would tell us if this vaccination will be yearly, bi-yearly, or whatever. I think with that answer, we don't know for now. And so that is why research will continue to be useful in understanding these parameters.
Thank you very much. Another follow-up question from Sarah Javin of DEVEX. She said you mentioned that if not done properly, a vaccine rollout could have an impact on other vaccines. She wants to know what you mean by this. And she's asking if there is any concern that this could increase anti-vaccine sentiment.
So let's admit it that there's a huge movement out there called the anti-vaccine movement, and we have to address it squarely. We cannot wish it away. We have to focus our energy there and find ways to continue to assure the community that the vaccines are safe. And that is why it was very important very early on when we started doing the vaccine perception survey to account for that. And we did that at scale. We did that with 15 countries. And again, in the coming days, we'll be able to discuss the results with you fully. So what I meant is that we should really approach the COVID vaccine vaccination with total transparency with respect to address the community questions as much as possible, as we are doing now, be very explicit to the targeted community what it is that the vaccines, especially the new concepts of the vaccines that have been introduced, like the messenger RNA vaccines, so that we continue to establish trust or strengthen that trust with the community. Because if the community, if the trust factor suffers, then it will spill over into the routine vaccines that we take every day. I think that is what I meant by handling it well, so that there is no spill over in respect to misinformation or total distortion of information that will affect the routine vaccines that we normally receive.
Thank you very much for the answer. I have 2 questions from Rhoda Odiambo of BBC. The first one, she says, is the Africa CDC aware of Morocco's intention to start mass vaccination using the Sinopharm vaccines month? Has this particular vaccine completed, and has the vaccine been approved for emergency use in other countries? Then the second question is, you mentioned that the Africa CDC is working with the World Bank, Afrexim Bank, and the Africa Development Bank to get vaccines for the continent. Will this support be in form of grants or loans?
So with respect to Morocco, for that particular vaccine, the only information that we have for that vaccine is that that has been generated from the United Arab Emirates. I think it's just yesterday that we read about the vaccine and the efficacy of the vaccine. I think that they just completed a phase 3 trial there. For Morocco, we've written to Morocco officially initially our understanding was that it was a clinical trial, not necessarily a vast immunization. So we've officially written as a member of the African Union, a note verbal to Morocco and Egypt to try to understand what is going on with respect to the vaccines that they are using. We will be issuing guidance in the coming days with respect to how countries should approach vaccines if they do it silo, if they do it individual. I think we are keeping all the options open. We 55 states. All we can do is to say coordinate through us. But if countries want to do work silo, we'll be giving them guidelines on with respect to safety. What should you be looking at safety? What should you be looking at efficacy? And how should you be preparing to roll that out? I mean, how do you roll COVID-19? So that's all I can say with respect to that, the Morocco issue, and based on the information that we have.
Thank you very much. And then we have another question that will come from Sophie Mukwena.
How are you going to deal with the issue of vaccine nationalism, a rush or a scramble for vaccine, particularly by those developed countries? We know that they have already placed orders of large quantities. How are you going to ensure that Africa is not left behind? And also, with America having a new administration or going to have a new administration, and President-elect Joe Biden having indicated that he would rejoin the World Health Organization, are you optimistic that America rejoining the World Health Organization will assist in a global coordination in terms of fighting this virus?
I think, let me start with the second question. I mean, and answer it this way, that America's leadership in global health has always been instrumental and has always been defining in times of need, especially for the continent of Africa. I mean, we should the PEPFAR program, the President's Emergency Plan for AIDS Relief, which started in 2003. Over $90 billion have been invested on the continent for treatment and prevention of HIV/AIDS. So I think I use that point of reference to say that we as a continent have always been grateful and benefited from the leadership that the United States, the people and their leadership have exercised. So we expect nothing short at this critical junction where we find ourselves dealing with a pandemic that requires an effective vaccine and potentially an effective treatment. I think that's the way I look at it. And we recognize some of the narrative that we are hearing from the Biden President-elect's administration. We are very encouraged of the warm words that we are hearing about engagement with the World Health Organization. But with respect to vaccine nationalism, this is what I'll repeat this, that the moment we have all been talking about global solidarity, global cooperation, and the ethics of vaccine is now that the vaccines are there. And it is my appeal to the United Nations to really summon a special session to discuss vaccine timely and ethical and fair allocation, so that the world do not look confused, and so that the world do not get into a mood where we begin to create this north-south distrust with respect to access to vaccines, which is supposed to be a common good. We know that COVID will not be defeated in the West alone, that COVID will be defeated all over the world, including Africa, a continent of 1.2 billion people. So I'll go ahead and continue to make an appeal that a special UN session needs to happen so that we put everything on the table and discuss boldly, courageously, to the extent that if the discussions are uncomfortable, they're uncomfortable, but that's how we come out strong as a people living on the same planet. I think if failure to do that will get us into this dialogue of suspicion and where we do not have trust, and we need trust capital to win this battle against COVID-19. Otherwise, we'll be in for much, much longer time.
Thank you very much. We have another question from of Africa Health Times. Is asking, how will you react to some messages on social media, supposedly from scientists speaking in vaccine, COVID-19 vaccine, and discouraging people from accepting it?
So it's very unfortunate that, to say the least, that people that come in with what is perceived as credentials to be mobilizing the community against COVID-19 vaccines. My reflection is that you trust your public health agencies, trust the Africa CDC to give you the right information, trust the World Health Organization to give you the right information. These are not organizations that are out there to, so these are organizations that are out there to watch out for the safety for this vaccine, because what is at stake is huge. The principles behind vaccinology is simple. It's the same principle that we've used over the history of vaccinology, be it for measles, for TB, for flu, for cholera, for all the vaccines that you and I have taken. Again, as I keep reminding people, personally, I've taken over 10 vaccines in my lifetime, and I'm healthy. And just to address that question, I'll say, if there was a vaccine today in Addis Ababa, I will be driving right there to that vaccination point to get my vaccine. I'm a virologist and immunologist for 32 years, so I know what I'm talking about. I'll go get that vaccine without hesitation. So it is really unfortunate that we continue to see those videos circulate. And just to conclude on that question, that we all take on our own collective and individual accountability and discipline, that we do not forward those videos when we receive them in our different WhatsApp messages. Is distorting. It's extremely manipulative, because they know that when they have such videos, people will circulate it and they will just continue to replicate like a virus. I think we should try to stop it. I mean, we should say to ourselves that I'm the last person to propagate false information by not sharing that video.
Thank you very much. And then we have another question from Addis Getachew of Anadolu Agency. He is asking, how many doses of vaccines do you think Africa will need? And what segments of the society should be given priority in terms of vaccination for COVID-19?
So as a continent, if we strive to get to 60% of immunization, so 60% of 1.2 billion people will place us around 750 million doses of vaccines. And you also always have to factor in the loss. I mean, there will be vaccine loss, where when people open vials, they don't store it well, they don't use it anymore. And you also consider that we need 2 doses of those vaccines to complete an immunization course. So you get a first dose, which is what you call the prime, and then after a month or so, you get a second dose to boost your immune system. So we'll be looking at about 1.something billion doses of the vaccines to achieve our stated target of 60% vaccination. I think that's what that 60% means for our continent. And we should always know that about 5 to 10% of vaccines will be wasted, that is not used properly.
Okay, and quickly we have two related questions, one from Dingani Masuku and another from Andrew Meldrum. The first one is, in which vaccine is likely to reach? Second one says, has China offered its vaccines to Africa?
I think it's difficult to say. We are very open to vaccines that have been approved through a country X with vaccines. And as I stated earlier, we shouldn't just say, well, you need a minus 25 degrees Celsius. We should say, well, if we get a Moderna vaccine, we can start vaccinating in your capital cities, and you put minus 80 or minus 20 deep freezers at multiple sites and start vaccinating. And that would allow us time to start vaccinating while waiting for the newer pipeline for vaccines. Looks very encouraging. I mean, COVID vaccine looks very, very encouraging. So who knows, in the next 2 weeks or 3 weeks, other trials may show that other vaccine constructs are giving us the same results, and they require less stringent conditions for storage and transportation. So the key there is to start vaccinating and in your major cities, and then have plans to roll it out as the new versions are more adapted versions of the vaccines are made available. With respect to China, as I said earlier, we are in discussions with the government of China. China is also talking to individual countries. We all encourage that such dialogue should go through the Africa CDC and the African Union. We encourage that countries should also defer such discussions to the Africa CDC and the AU for coordination. The AU and the Africa CDC is a member state instrument created by member states, so they should really be using these instruments to engage with their companies so that we truly have the whole of Africa approach for these vaccines acquisition.
Thank you very much. So we've come to the end of this briefing today. But just one clarification on the question from Rhoda Odiambo. She wants to know if the support from the banks are going to be grants or and then from there you can give us a final word.
No, absolutely. I think from the banks, it will be a combination of the loans, grants, and other mechanisms. I think it will all depend on the specifics with which bank we're dealing with. I mean, the Afri-Exim Bank, of course, and their promissory notes, their long-term concessional loans, and stuff like that. I think there's also the World Bank, as you know, has put out $12 billion, and we are working with them. As of yesterday, we were in extensive discussions with them just to discuss exactly that. So it will be a combination, in my view, of both. Just my closing remarks is that we really go through the holiday season, we'll see the infections increase across the continent. When we come back in January and February timeline, I think it is therefore a collective responsibility that at multiple levels that the political leadership continue to increase a campaign for mask wearing massively. As I move through the continent, it's unfortunate that I see the clearly signs of prevention fatigue. People don't wear masks enough, or they don't wear it correctly. They actually carry it, but carry it poorly. I think the authorities need to do something there, because we approach a very, very sensitive period, which is the holiday festivity period there. Then the individual citizens have to really say, well, these are times that are unusual, unprecedented. As we go into the festivity seasons, let's be sure that we protect ourselves and protect our loved ones by doing the right thing, which we all know I've discussed here over and over. So I think that is what I mean. I'll end at that, and just wish you all a wonderful week and a wonderful day.
Thank you very much, Dr. Nkengasong, for the updates and the answers to the questions. And I'd like to thank everyone who has participated in the briefing today. So next week, remember, there will be a report of the vaccine perception survey that was conducted in member states, and we hope to see you then. Thank you.